I am Dr. Rajendran. I am a consultant neurologist in Apollo Hospitals, Greaves Road, Chennai. This is Migraine Awareness Week. So today I am going to talk about migraine. What is migraine? Migraine is one of the commonest causes for headache in the community, and migraine generally occurs, starts in the younger age, like in the teenage, in the 20s, but it can affect at any age. Usually migraine causes headache on one side. Having said that, migraine can cause headache on either side or the whole head. Usually it is associated with nausea and vomiting, and with phonophobia, that is sensitivity to sound, and photophobia, which is sensitivity to light. So they are not able to tolerate light and sound. And sometimes osmophobia, which is they are very sensitive to smell, like scent smell, like that. Usually there are two types of migraine. One is called migraine without aura, previously called common migraine. Some scientific person belongs to this category. And another one is migraine with aura, previously called classic migraine, where aura is a warning sign where a patient can have some symptoms associated with vision in the form of flickering lights, flashing lights, zigzag lines, sometimes like waves, and sometimes what we call scotomas, which is dark black spots. This usually precedes the headache and sometimes can occur during the headache, and usually lasts for a few minutes to an hour or so. Migraine causes headache, which is usually in a throbbing or a pulsating headache, and it lasts for 5 hours to 72 hours. And migraine usually triggered by traveling, exposure to sunshine, and patient having stress. Sometimes when the patient misses meals, skips meals, sometimes due to lack of sleep, and usually relieved by rest in a quiet dark room, and with painkillers, over the counter pills, like that. And migraine usually occurs more commonly in women, much more common than in men, but it can occur in men also. There are other causes of headache. We have to rule out other causes which can imitate migraine. And the one major cause is called tension type headache, previously called muscle contraction headache. So in tension type headache, you do not have all the features I suggested. So there won't be nausea, vomiting, light sensitivity, sound sensitivity, relieving by rest, will not be there in tension type headache, which is also called as featureless headache. There are other causes of headache which is grouped into trigeminal autonomic cephalgia, like cluster headache, which comes at a particular time and occurs in groups. So it's called cluster headache, which is quite rare. And we have to make every effort to rule out a group of headaches called secondary headache due to some serious conditions like a brain fever or any bleeding in the brain. So when you see the neurologist, he will be able to differentiate between these two by examination and by appropriate investigations. So are there any treatment for migraine? There are good medications both to control the acute attack and also to prevent migraine headache. Simple analgesics like paracetamol can be used during the attacks, and there are more specific migraine specific drugs called triptans, which are given only for migraine, which are effective and usually given when the first line drugs, simple analgesics, are not effective. And for prevention, there are a few drugs that can be given on a long term. Migraine is a recurrent type of headache, like it keeps coming episodically. Sometimes headaches can be continuous. If it is more than 15 days per month, we call it chronic migraine, so which requires medication for prevention. And there's another group of headache called medication overuse headache, which should be identified. If you, especially in people who take over the counter medication frequently, the medication themselves can cause a headache, that is medication overuse headache, and that is the reason why we should not self treat. We should always consult a physician or a neurologist. Thank you very much for listening.